The opioid epidemic came up last month during President Biden's State of the Union address. He called it one of his priorities.
So much we can do. Increased funding for prevention, treatment, harm reduction and recovery. Get rid of outdated rules and stop doctors that stop doctors prescribing treatments.
That funding is in the president's budget for next fiscal year. He's asking Congress to allocate almost $43 billion to National Drug Control Program agencies. The White House says that would significantly fund evidence-based prevention and harm reduction services. The need for these services is growing fast, but one treatment in particular has proven especially hard to get. In the first year of the COVID-19 pandemic, the Centers for Disease Control reported that 100,000 Americans died of drug overdoses, a historic high. Experts attribute this spike in overdoses not to the virus, but to a drug, fentanyl. According to the CDC, this synthetic opioid is up to 50 times stronger than heroin and 100 times stronger than morphine. It's often laced into other illicit drugs, poisoning unsuspecting users. The National Institutes of Health says that almost 3 million Americans are dealing with opioid use disorder. Some say harm reduction is the answer. One strategy? Different drugs that compete with opioids in the body.
Medications such as methadone and buprenorphine. These medications sort of sit on the opioid receptor. They bind to the opioid receptor, but they tend not to activate it in the same way, and so that they just prevent craving and withdrawal.
These drugs are called opioid agonists. The Drug Enforcement Administration regulates these medications and limits how they can be prescribed. Dr. David Feline specializes in addiction medicine at Yale. He says the regulations can limit access to these medications.
We know that probably only 25 or 20% of individuals with opioid use disorder in any given year have access to these medications. And you think about that, that would be completely unacceptable for any other medical condition.
Methadone was the original opioid agonist treatment. It cannot be prescribed outside of an OTP, an opioid treatment program. You have to arrive in person, and until you've proven that you can be trusted with medication to take home with you, you generally have to show up every single day. It can be a full-time job just going to get your medicine every day.
The DEA is taking steps to expand access to these types of treatments. Some families say this expansion cannot come soon enough. Jennifer Hornack lost her son, Quincy Berry, to an overdose.
Quincy passed away from a drug overdose when he was 31. He had problems with opioid use for a decade. He had been into rehab twice.
A relapse led Mr. Berry to search for a new rehab center. She says he could not find one that would let him remain on the opioid agonist Suboxone. He ended up going to a facility that weaned him off of it.
And I was like, well, okay, that's good. They know what they're doing. Well, he got discharged and he was dead within 27 days. He had overdosed because he was opioid naive. He had been off of, opioids except for the Suboxone, and then they had weaned him off of that. And he had multiple things in his toxicology from his autopsy.
Not everyone can afford these types of treatments. According to the National Institute on Drug Abuse, opioid treatment can average almost $130 a week and around $6,000 a year. West Virginia has been hit hard by the opioid epidemic. Martin Njoku is a pharmacist there. He says the DEA paid him a surprise visit back in 2018. It issued an immediate suspension order for his business and took away his registration to dispense controlled substances. Court documents showed that the pharmacy was registered with the DEA to handle controlled substances. Mr. Njoku says when he fought the case, the judge ruled in his favor. NBC News has reached out to the DEA for comment. Martin Njoku says the agency's enforcement gave his pharmacy a devastatingly bad reputation.
We have so many pharmacists, who will not dispense Subutex or Suboxone because of the DEA. You are pushing us away from giving people or taking care of people who need the Subutex or Suboxone, to stay alive.
Back in 2020, almost 60 million Americans had used illicit drugs the year before. That's according to the Substance Abuse and Mental Health Services Administration. It's an immense problem. one that advocates say demands new answers.
With the current administration, they've given a lot of talk to harm reduction, which is great. And they are actually putting some money where their mouth is, and they're offering some grants to harm reduction organizations.
I think the important thing that we've been working on is to make sure these medications are available through general medical setting. We like to use what's called a no wrong door policy, so that wherever you show up in the healthcare system, there's somebody who's able to make a determination and start you on your treatment pathway.